shamans would treat patients, and the diseases were thought to be elements of the spirit world. Well, physicians today treat infections, and those spirits are bacteria that are pathogenic or viruses. So whether the shamans called them spirits or whether the scientists called them microbes, with the invention of microscopes, we get to see the microscopic universe and landscape that we thunder upon with every footstep. The fact that these fungal networks are seemingly invisible but then represent themselves in a big flourishing mushroom in a matter of a few days give us a window into the invisible landscape underneath our feet. Fungal networks have defended themselves against vectors of disease for millions of years. Viral pandemics occur periodically. Between 1347 and 1353, 1/3 of the European population died from the Black Plague. The Great Flu pandemic of 1918, 2% of the world population died. Millions upon millions of people. I think everyone is aware of the threat of bioterrorism, but few people may know that Europeans were actively involved, consciously or unconsciously, in bioterrorism against indigenous peoples, especially in the New World in Mesoamerica. They brought in diseases, and when you're extremely sick, you can't fight off an invader. It's an irony of history that now the US government is interested in protecting people from viral pandemics.
Paul Stamets cultured numerous strains in his lab and prepared natural extract. He then submitted samples to the Defense Department's BioShield program for testing.
And ironically, I have a debt of gratitude to Dick Cheney and George W. Bush.
It is vital that our nation discuss and address the threat of pandemic flu now.
Their funding of that research led to some very novel discoveries, which we're still elaborating today. What we know about these mycelial networks is they're learning membranes. They are self-learning and network-based organisms that can share and store knowledge. The mycelium is vaccinating itself against pathogens in the ecosystem. We can capitalize on this because many of the same bacterial pathogens that infect fungi also can infect animals. We found novel molecules highly active against pox viruses, novel molecules highly active against HPV, the human papillomavirus. Many scientists are trying to come up with the next antibiotic, the next penicillin. But we have barely tapped into the fungal genome, especially the mushroom-forming fungi. Think of it. Our old-growth forests that contain these ancient fungi are deep reservoirs of potential compounds that can fight pandemic viruses. We should save the old-growth forests as a matter of national defense.
I recommend mushrooms and mushroom products frequently to patients, and I teach other doctors about their uses. Mushrooms have molecules not found elsewhere in nature. There's some that have totally unusual properties, like lion's mane mushroom.
The lion's mane mushroom is a globular, cascading, icicle-formed mushroom. It tastes like lobster or shrimp when you cook it, but a researcher in Japan by the name of Kawagishi discovered it in around 1993. And I don't have the foggiest idea how he discovered this, but he discovered that this mushroom stimulates nerves to regrow. And he postulated it could be an effective treatment against Alzheimer's.
Since we don't have anything for Alzheimer's, and since this is non-toxic, we should test it. Mushrooms are completely unusual organisms, and they're ignored by so many people, and yet they're a vital interface between all forms of life. At the University of Southern Florida, a very interesting study came out. Mice were trained to have a conditioned fear response. And so when there's a sound that was associated with a pain, later on when they just heard the sound, they cowered in fear. When they treated the mice with psilocybin, the compound in magic mushrooms, the mice dissociated that link. The mice overcame the fear conditioned response.
We started with very low doses to as high a dose as 1 milligram per kilogram. Now, what was interesting If you look at double-labeled cells, in other words, the birth of new neurons, we saw an increase in neurogenesis.
Neurogenesis literally means neuro for nerves and genesis, rebirth or beginning of. The regrowing of neurons. They were not using the same neurological pathways they have in the past. This is really exciting because it means that the brain has a plasticity about it, is able to heal, is able to grow. It just needs the right compounds to help it develop new neurological pathways. We're all getting older. We'll all suffer some degree of dementia. What compounds can we take that enhances and preserves neurogenesis? I know many, many people who would not dare take a psilocybin mushroom trip. But the concept of them taking 1/50th of a dose, something like that, and it causes neurogenesis that might make them smarter and a better mood or happier, that's a whole different subject.
We are on a never-ending search for partners. Life-affirming relationships. Or at the very least, nourishment for the next leg of our journey. We have flourished side by side with your species, symbiotically, for centuries.
Many shamanic cultures relied on mushrooms for their transcendental experiences. This is pre-religion all over the world. It was all about the individual's connection to the spiritual world, or the mystery. That is our context for living.
These are ancient artifacts from the Mayan culture. These are called mushroom stones. This may be the largest collection of mushroom stones in the world. The Mayan culture was very mycophilic, and they revered mushroom stones for divination, for spirituality, also to be able to predict incoming armies and how to strategize against them. A great ethnomycologist by the name of R. Gordon Wasson came up with the phrase mycophilia, the love of mushrooms, the Mayans shared. Mycophobia, which is classically the English had a fear of mushrooms because they're enigmatic. You know, these mushrooms can get you high, they can heal you, they can feed you, they can kill you. And so that which is so powerful is naturally feared.
Wasson was an amateur mycologist, a person who studies mushrooms, and was invited to participate in a ceremony by a curandera, Maria Sabina, in 1955. He took these mushrooms and had a psychedelic experience.
And when R. Gordon Wasson came out with his research that was published in Life magazine in 1957, that was basically a field guide to psilocybin mushrooms delivered to tens of millions of Americans on their doorstep during the peak of the Cold War. This then was quickly noticed by academics at Harvard and other Ivy League schools, and then the cognoscente, including Timothy Leary, Ram Dass, and Dr. Andrew Weil.
Why do mushrooms produce molecules that fit receptors in the human brain and body? What does that say? What does that mean? I mean, does that mean that we're supposed to be using these things?
Psychedelics during the 50s and 60s were the cutting edge of psychiatric research. There were remarkable studies with very, very promising findings.
Psychedelics became part of research in psychiatry for 30 years, and there were several very interesting indications that they were researched. The best data was actually for alcoholism.
We found that having a mystical experience during the course of one session was the strongest predictor of positive outcome, meaning maintaining sobriety over the long follow-up period. It was very impressive.
Some of these drugs, you know, they had escaped the lab, as the phrase goes. Millions of people were using them, and you have to realize that this was a radical force unleashed in the West.
the kids who take psychedelics aren't going to fight your wars. They're not going to join your corporations. They won't buy it.
A lot was going on back in the 60s. There was a time of rapid cultural change. There was irrational fears about too much cultural change too fast. President Nixon called Timothy Leary the most dangerous man in America.
We must wage what I have called total war against public enemy number one in the United States, the problem of dangerous drugs.
When everyone says shrooms to me and invokes this whole idea of using psilocybin mushrooms as a party drug, they are so much more important than just getting high.
The movement to marginalize the major psychedelics is incredibly complex. I mean, it plugged into a counterculture movement, an anti-war movement, an anti-establishment movement. But there are many, many forces that were at play.
Somehow the fuse blew, and one of the victims was the medical research with psychedelics. There's a very irrational and anti-scientific climate that was fueled even in government pamphlets, really had distorted information that was not scientifically accurate.
A bad trip, instant insanity.
The research came to a halt in 1970. War was declared on drugs, the Controlled Substances Act was passed, and the research essentially was erased from being taught in psychiatry.
I think I may have the dubious distinction of being the last to give psilocybin to a cancer patient at the Maryland Psychiatric Research Center. And then the research became completely dormant. In our evolution as a species, we're at a point of coming to terms with a major paradigm change. A change in how we view what we call reality. And that always evokes tension and fears. The culture wants to cling to the old view of the universe.
You realize that you've been limited all this time with your perspective of reality. Had reality been known to you at this level early on, how much more evolved would we be as beings? A lot of people would be afraid of that. So this is very dangerous territory. People want to give up the responsibility of being able to understand. And because they can't understand, then they have faith. And they put their faith in other people who say they can understand. And I think it's a situation that's ripe for a predatory relationship.
Anyone who's had one of those experiences in a country where it's not legal to have them is stuck in this position where something really precious and really giving a great gift to you is not understood by the culture at large, and furthermore puts you or other people and other people at risk of prosecution. And one response to that is to get angry and to want to fight that. And another response to it is to say, we just got to explain to people what's going on here. And when people understand it, then there will be accommodation and respect. There are a number of elders living in the Bay Area who've devoted some part of their career in psychology or religious studies who ended up being invited to a small invitational conference at Esalen called the Pacific Symposium on Psychedelic Drugs. As we went around the room making introductions, most of the people who were clinicians were excitedly talking about what kind of clinical trial they would run if they could use one of these substances to treat PTSD or to treat depression.
We wrote the best design we could. We submitted it to the FDA, and they approved it. This was 1999, and it reactivated psychedelic research after basically a 22-year dormancy in the United States.
It's like a Rip Van Winkle effect, you know? It's waking up 20 years later, the methodologies, the questions that we can ask on so many different levels.
I've been diagnosed with prostate cancer. My diagnosis was so bad that it was, you know, they weren't giving me any chance whatsoever.
My diagnosis was kidney cancer, finding out that you may want to get your affairs in order.
I first found out about the study when my oncologist gave me a pamphlet. He said, here's something that might be able to help you with the anxiety. And I was accepted into the study.
The most important thing is to remember that you're always safe. And a recommendation is that whatever is coming up, that you allow it, that you don't have to like it, but you say, okay, rather than trying to run away from it. Once a volunteer is enrolled in the study, they're with us for the preparation, the psilocybin sessions, and the integration follow-ups after. I have been a guide for around 350 psilocybin sessions, and then about 1,000 of the preparatory and integration meetings.
All right.
Good. Okay, lift your head up. It's really just about experiencing what comes up as psilocybin takes effect.
And the intense part of this journey, this world and things that matter to most people, family and all that, that wasn't even what it was about. They say anything mystical can't be explained. It's something like that. It's a feeling of such immense power that you can't even imagine. I've never felt anything like it before. It was about being in a place of infinite space and just being there.
There's an experience of positive mood, sometimes open-heartedness, love, transcendence of time and space, and then finally it's thought to be ineffable. People say, I can't describe that experience.
In my mind, I said, okay, hold it. If I give myself over to you, can you promise me that I will be in at least as strong a shape as when I entered this room? And I felt a voice that I needed to heed. Do you think I would disrespect my own handiwork? This is the voice from on high saying, do you think I would disrespect my child? And I felt so beautiful. I felt like I have never felt before. My sense of being loved, of being worthy, of love, of being cared for, of being important to someone. It's huge.
Keep going into it. Doing beautiful.
One-third of individuals in the study said it's the single most spiritually significant experience of their lives. About 70% say it's among the 5 most personally meaningful experiences of their lives. And you say, well, so what does that mean, you know? And initially I thought, I wonder if they don't have